Welcome to the Iridex Generation 2 MicroPulse Transscleral Laser Therapy Delivery Device Didactic. The Generation 2 MicroPulse delivery device introduces improvements to the ergonomics of our current MicroPulse probe while also lessening the number of technique variables associated with the MicroPulse Transscleral Laser Therapy. MicroPulse contact laser delivery requires the ability to perform two fundamental concepts. Number one, optimal tissue coupling between the delivery device and the tissue interface. And two, the ability to deliver constant, consistent pressure from the footplate to the tissue. The MicroPulse Generation 2 delivery device allows you to safely comply with these two fundamental requirements while adding improved ease of use. It is important to note that many current MicroPulse users have optimized their treatment paradigms in their hands on their patient populations with their own techniques. To ensure maximal patient safety prior to utilizing the MicroPulse Generation 2 delivery device, please familiarize yourself with the design differences as well as the recommended base treatment parameters. The design elements of the Generation 2 MicroPulse delivery device focused on improved ease of use. Having the ability to couple with the target tissue allows you to deliver more energy in a much more consistent fashion than our currently designed probe. We have engineered a recessed fiber tip and added a fluid channel to enable consistent fiber immersion in the fluid during treatment to improve light coupling to the tissue. By recessing the fiber, we have the opportunity now to be able to apply pressure in a consistent fashion as we sweep across the globe. We've also integrated a concave scleral matching footplate face curvature to improve probe stability. Instead of being on a point, now our curvature of the delivery device matches that of the sclera and gives you a much more stable, consistent point of pressure. The orientation of the probe has now been improved as well. We have added a limbal matching footplate curvature to the delivery device, which is to be oriented on the surgical limbus, leaving no variability in terms of placement of the delivery device. Additionally, we reduced the footplate size for easier placement in compromised eyes with limited exposure. This reduction in the footplate also adds visibility to be able to see where the actual spot from the laser delivery fiber is being delivered to. We've elongated the stem as well, which adds additional visualization to the eye during treatments and can be used as a speculum to hold back the lids while delivering the treatment. When we look at the updated footplate, you can see the scleral matching curvature on the picture on the left, and on the picture of the right, you can clearly see the fluid channel and the limbal matching curvature. The fluid channel helps to gather all of the fluid around the fiber interface so that that viscous liquid coupling agent is consistently available to make sure that the energy level is being distributed in a very consistent manner. We also show a scleral matching curvature. You can now see on the picture in front of you the posterior portion of the stem, which will slide underneath the lids, and the limbal matching curvature, or bunny ears as we like to call them, which is going to be placed on the surgical limbus. It's important to note that there's also a slight bend in the fiber. The bend helps us to treat in a more perpendicular fashion with the energy cloud being delivered by the fiber. We believe that this places us much more consistently over the ciliary body as opposed to a 45-degree angle or wedge of treatment that we utilize with our current MP3 device. It also matches similarity to our G-probe application profile. And you can see here on our photon dispersion profile comparison that indeed the Generation 2 and the G-probe alignment system is much more perpendicular than our Generation 1. It's also important to note that this is a cloud of photons. This is not a spot-sized laser. So you are delivering a cloud of energy that, from a profile perspective, can be up to 1 millimeter to 1.5 millimeters wide, which is also additionally why we feel this perpendicular treatment profile is much better for the efficacy component of our MP3 Generation 2 MicroPulse probe. Our next slide here shows you on the left-hand side a graph coming out of the Wellman Laser Laboratory in conjunction with the Lubick Laser Laboratory of what at 800 nanometers in a perfect environment, the amount of reflection, transmission, and absorption using contact laser delivery on the sclera will produce. And I think it's important that, on an absorptive factor, the best case scenario is you're going to get about 6% total energy to be absorbed, which is why it's so important to have excellent tissue coupling and the ability to apply pressure so that you start out with the ability to deliver all of the laser energy as opposed to starting off with a negative. The slide or picture all the way to the right shows you our Generation 1 treatment profile. It's perpendicular to the sclera, which does lead to some interpretation as to what that angle truly is, since the probe does treat similarly to be on a point. So you can drop your hands and be at a lower angle or increase it and be at a higher angle, which leads to more variability in terms of where this energy is being delivered. The current probe design also lends to being able to rotate the probe. And in being able to rotate the probe, again, it's variability in terms of where is that energy being delivered consistently and how consistently can you deliver that energy from patient to patient and surgeon to surgeon. If you look at the center picture, the Generation 2 now with a angled scleral matching curvature and an orientation that sits just on the cervical limbus with no variability allows us to fix the delivery device so that the treatment is going to be delivered to the target tissue in the target zone in and around the interface of the sclera and superciliary space as well as the ciliary body. So the design leads to much more stability, much more consistency, and the ability to consistently treat from patient to patient and surgeon to surgeon. The training component here is also much different. Many of the variables which are now part of the current treatment paradigm have been eliminated based on these ergonomic changes that have been made to the footplate of the Generation 2 delivery device. The probe still must be used with a viscous interface. That viscous interface now will be held in that channel around the fiber more consistently and should result in much more consistent delivery of energy. We're orienting the probe very simply with the limbal matching curvature being on the limbus or the bunny ears towards the limbus. This is the widest part of the probe itself. Easy to visualize and really no variability in terms of where it goes. It can be now viewed very easily from the side, from parallax, and from the behind the probe, since the stem has been elongated, and you can now visualize the entire foot plate and the fiber within it, which you cannot do with our current probe. We maintain the foot plate of the probe flat against the conjunctiva with a scleral matching curvature now. So now you have the ability to be well coupled, as well as the ability to apply consistent pressure throughout your treatment as you sweep across the eye. Those are the three main callouts for the training and the technique variables involved with utilizing the MicroPulse Generation 2 Transscleral Laser Therapy delivery device. The parameters in the technique, as I just described, have changed, and as such, we want our base settings to be, again, do the most amount of good with the least amount of damage. Our training parameters are 2,000 milliwatts at 50 seconds per hemisphere, or 100 seconds total treatment to the eye at a duty cycle of 31.3%. We are sweeping the probe along the limbus in an arc-like format of about 150 degrees at 10 seconds per sweep. So at 50 seconds per hemisphere, it's 5 passes per duration. Superiorly, and then 50 seconds inferiorly, 5 passes per duration. As always, we avoid the 3 and 9 o'clock meridians. Thank you for taking part in this didactic. There will be a following quiz, of which once you complete, we will schedule a in-house dry lab training and proctored cases to follow. Then you have completed the certification requirements for the Generation 2 MicroPulse Transscleral Laser Therapy delivery device. If you have any questions concerning the new generation delivery device, or you would like to utilize the new Generation 2 delivery device, please contact your area sales manager or Iridex directly, and we can set that up for you.